Okay, we're here today with Maggie. Maggie's about to start her treatment with Dr. Davis. So, Maggie, tell me about those knees.
Well, I have a Baker's cyst on my right knee. Yeah, it swells all the time. Both knees are achy. I had a little orthoscopic surgery on my left knee a couple of years ago. It's difficult to walk and stand, and it's not getting better. It's getting worse.
Okay. What did the orthopedic tell you about the Baker's cyst?
Well, he basically said that, we'll blow up, we'll go, sometimes go down, and when I'm in my 70s to give him a call, because that's probably when I'm going to need knee replacements. And I can take some ibuprofen to keep the swelling down, 800 milligrams, which is a little excessive, but anyway, that's what I was told. And
Okay.
It's not good enough for me.
Yes, we want to get it better. Find the cause of the problem and correct it.
Correct.
Okay, great. Well, we're going to do a couple different exercises. We're going to see what group of muscles we want to work with first. So the first thing I'm going to have you do is I'm just going to have you stand up for me. Now, did you feel any discomfort when you did that?
A little pressure.
Where did you feel it?
Both knees.
In the front?
Yes.
Okay. All right. So now I'm going to have you go up and down the stairs for me. So there's a handrail right there. All right, and we're going to go back up. So Maggie, which was worse, going up the stairs or coming down?
Going down.
Down the stairs? And where were you feeling it when you were going down the stairs?
Well, the pressure all in both knees.
In both
the middle.
knees?
Yeah.
Okay.
Yeah.
All right. All right. So out of all the exercises we just did, which caused you the most pain?
Going down the stairs.
Down the stairs. All right. We know where to start. Are you ready to get started?
I'm ready. To
All
get
right.
So your body sometimes doesn't like change, so it might resist a little bit. If you get sore, you feel something tighten up. It's just your body, processing.
Right.
And then I'm here for the next 11 visits to do any tune-ups.
Perfect.
That's why I have you come back in.
Thank you.
You're welcome.
All right, Maggie. I'm going to have you walk down the hallway for me. Go all the way down to the end
Okay.
and come on back.
Anything different going on?
How you feeling?
Lighter. And I just a very little pressure into the right knee. No pain.
I have a lot of people say that they feel lighter. They're like, I don't know how to describe it, but I feel lighter.
I feel lighter and
'Cause you're
just
not
a
stomping when
just
you're
a
walking.
little tension, just very minor. But other than that,
Well, we're going to go outside and try those stairs again and go from sitting to standing like we did before so we can tell the difference. Maggie's finished her non-surgical operation with Dr. Davis on those knees. So let's try them out. I'm going to have you stand up for me. And how was that?
wonderful.
Much easier than
I could
before?
Get right up and no pain.
And no pain at all.
No pain.
All right, let's try the stairs, Maggie.
This is
Keep smiling, right? Look at you're like a pro now. And down the stairs was the worst for you before.
it was. I didn't feel any pain.
So you were at about a 5 when we started.
Yes. Now it's no pain. Zero.
It's down to a 0. We haven't even done therapies yet.
I know. I'm so excited.
So this is life-changing. This is going
yes.
to change your life, and you're not going to have that pain anymore.
Right.
Are you happy with today's
I am
visit?
More than happy. I am thrilled.
Yay. All right, let's go do some therapies. Get you feeling even better.
Yes.